So at the MPN meeting today, I've presented a range of patient case studies that have looked at different challenging scenarios in chronic myeloid leukemia, looked at patients who have had non-hematological toxicity, hematological toxicity, patients with advanced phase disease, patients proceeding to transplant, and then patients developing comorbidities on TKIs and how those were managed. Thinking about a specific case, we had one patient who went into the Matchpoint clinical trial who was a patient who presented with accelerated phase CML, who despite having a second generation tyrosine kinase inhibitor within 6 weeks proceeded to a myeloid blast phase. They then went into the Matchpoint clinical trial where they had a combination of intensive chemotherapy in the form of FLAG-IDA with ponatinib, and despite that they didn't go into remission after treatment, and they then proceeded to a stem cell transplant. They developed severe graft versus host disease following the transplant, and we were unable to restart a tyrosine kinase inhibitor after transplant, and sadly the patient died from relapse around about 9 months following their transplant. And I think this is a really salutary case that CML can still be a deadly disease for some patients who present with an aggressive form.